Dr. Dinesh. Thank you so much for joining me in this podcast, Brain in You. Uh, I will quickly introduce you as the chair of pediatrics in the YAS Clinic Abu Dhabi. And so before we start, let me just give you an introduction about Ayurved, which works in the space of nutrition for brain, which can be consumed by anybody. We have till date catered to about 600,000 customers, and we have a parent community reaching out to almost 1 million of them. They will be the primary consumers of the content that we create today. And I know that you have done a lot of work in the area of screen and digital detox, along with feeding, gut, and supplements. So I think questions around these will be something that I will be asking you, and I'm very sure that parents will find it extremely useful. So before we start, why don't we get an introduction from you?
Thank you, Vandita, and good morning to all your viewers. And thank you so much for having me on your show. It's amazing that we connect on the same topic, the brain health. So it is not just about the nutrition to the brain. It is also about how we make our brain calm and how we look after your brain. So it perfectly aligns with our the digital detox program and the
Hmm.
brain nutrition. So the end product is to have the healthy brain so that we make our children as the brain superheroes. Thank you.
So before I start, I know you've done a lot of work, like you said, on digital detox. So my first question will be around the same, that how does screen time impact the developing brain of any child on the autism spectrum?
Thank you. That's a very interesting question. See, with regards to the autism, you have a problem with the social communication disorder, right? So, similarly, addiction to the screen creates the same kind of the pathway in our brain. So, if you look about a child who is under 2 years, who is on an excessive screen, you see them not talking. You see them not focusing.
Yeah.
It is very similar to what you will see in children with an autistic spectrum disorder.
Hmm.
So, and it also works with the reduction in the attention span and
Hmm.
attention problem issues as well. So, similar way as in autism, which can you can have an attention related problems. A child who has got a lot of screen overuse or addiction can exhibit the symptoms which are very parallel to something related to autism.
Hmm. Understood. So now, this is a tricky question that I'm going to ask you because this is something a parent would have definitely asked. What is the healthy screen time limit for an autistic child?
So the first and foremost, we talk about the normal child. So normal child, when we talk about any child under 2 years, should not have a screen time at all, zero screen time. Children more than 2 years and two up to 7 years, they can have a 1 hour of screen time, but for an educational and something learning purpose. And children 7 years and above, perhaps 2 years is reasonable. Again, if they're doing something fruitful. So when we come to autism, it doesn't make anything different. Again, of course, yeah, the thing with autism is children doesn't want to focus.
Hmm.
They don't want to maintain the eye contact, and screen can bring them a lot of solace. So the children with autism also can get glued to the screen far more than a normal child. So, and the screen can make it more addictive for them, which can impair their therapy and their well-being. So the same limits applies to the child with autism,
Yeah,
but the parents need to be extra more careful when a children with autism and screen.
understood. So while you touched on this a little bit, I will ask you to go a little deeper and tell me what are some red flags of digital addiction in an autistic child?
So first and foremost, let's talk about the digital addiction itself. So when we talk about the digital addiction itself is, you cannot get out of the screen. You start showing a lot of temper tantrums. You become very aggressive. Screen becomes your life. You don't even, connect with the people. You stop looking into your hobbies.
Uh,
What was your best hobby becomes the least of the interesting things.
Mm,
Your sleep get disrupted, your physical,
mm,
mental, and emotional well-being get disrupted. This the same thing can happen to the children with autism as well. So their therapy can get disrupted. They
mm.
can get become more aggressive. So same pattern of symptoms of what we call it as a screen addiction can be seen in an exaggerated fashion in the children with autism.
Understood. And I think in your daily routine, you will come across such cases very, very frequently. And where parents will come and tell you that, doctor, I try to do it, but there's a meltdown. So my next question is actually related to that, that how can parents break the dependency on screen without meltdowns?
See, first and foremost, if you think about the child, once they are, used to it, because they keep getting the rewards, that is where the children get hooked to
Mm,
it. And the people on the screens and the social media or maybe any content are very clever because they create a very predictive algorithm which makes it very very addictive. So that's why somebody who's just wanting to to look for a recipe for cooking can end up looking for
yeah,
the pet adoption. That's how it goes. So what is more important in children or anybody who's hooked to the screen is first and foremost, children parents have to understand there is a problem, and then they need to talk about it, and then they need to start giving times up. When you give a structure to a child, children tend to follow it up. So for example, let's say for example, after 30 minutes, we agree that we'll take the
yes,
time out. Maybe 5 minutes before they take the time out, they give another warning, and then they stick to the consistency. They offer
yeah,
them an alternative, an healthy
yeah,
alternative. Okay, so if you have used the screen time for 30 minutes, then we can do this 30 minutes of playtime. You're allowed. So you are fixing the focus from an one component to another component in a very
mm,
healthy way.
mm,
Especially with the children, even with autism, they like the structure. They want
mm,
predictability.
mm.
So if you work on this kind of a algorithm, they will slowly and steadily they will start to understand they'll come to the terms. So in that way, there may not be much of a fights or
Yeah.
upset between the parents and the children.
Actually, very, very true. I once, it's been 6 months or so, I watched a video of a mother who had a neurodiverse boy, and she laid it out so well. She actually said exactly the same thing, that give them structure. When you tell them you're about to take the iPad, you tell them in the beginning only that it's just for 20 minutes. And then
Yeah,
10 minutes before, you tell them I'm about to take it in 10 minutes. And then 5 minutes back, you again tell them that, just 5 more minutes left. So you actually prepare them. And as you rightly said, they like to be aware of what's going to come next.
yeah,
So, yeah, I think that I'm moving to gut
yeah.
now. And I know that you have a very deep understanding in this space. And um, not many parents understand how gut and autism are connected. So I would want you to go a little deeper here. So my question is, why are gut issues so common in children with autism?
See, first and foremost, we need to understand gut is a second brain. So the gut also itself behaves like a brain. So the many neurological issues can also be related to the gut, and I think with time we will be able to understand in a
Yeah.
better because the science is advancing in that direction. If you think about the children with autism, they have got their own set of problems with related to gut. Firstly, they have a lot of they experience a lot of tummy pain, intolerance, bloatings, and again there is no one reason for it. There could be n number of
Yeah.
reasons. I will enumerate a few of them. One is maybe because of the constipation, because they have a selective eating. They don't chew the food. They don't drink enough water. They don't take enough fiber. So that's the reason they can get constipated, and that can make them uncomfortable. They may have intolerance issues to certain food. It could be gluten, it could be lactose. Not necessarily all children, but some children, or to any other food, for that matter, which can make them have an unpleasant experience. They can also have what we call it as a very sensitive gut because they do have sensory perception issues. Similar way, their gut also becomes very extra sensitive, so they become very twitchy. So any kind of an anxiety, any kind of a stress makes them the gut very twitchy and make them uncomfortable. So it is not
Mm.
one reason; it is a combination
Yeah.
of all these factors to make them what they are and the gut of an autism. And it is very important for the parents to understand that it is not one factor, it is a
Yeah,
combination of factors, and we have to think about those on those
yeah,
lines.
yeah. Yeah, very true. Actually, some one point very interesting for me that I will go back and read more on is I know that they can get really stressed and anxious. And because of that vagus nerve that connects the brain to the
Yeah,
gut, which we say that, that highway, that they can feel the same sensation in their tummy. And that is when they suddenly feel like going to the loo. And the parent may think that the moment he eats, he's just passing
correct.
stool. So yeah, you're right. There could be a multiple set of reasons why there is, some kind of gut sensitivity.
Right.
And you touched upon picky eating and you touched upon gluten free. So my next two questions will be around that. That uh, what are the top three strategies to manage extreme picky eating in autistic children?
Um, so I wouldn't say top three, but the couple of this, because it's not one thing that would work. So first and foremost, set a meal time, meal place, and meal duration, because autistic children like the structure. So where you will give your meal, avoid distractions during the meal time. If they don't eat for 20 minutes, just take the plate out. Don't get upset. There's nothing is going to happen. So one thing, as a pediatrician of around 25 years of experience, I have realized is two things. One, if your child does not decide to eat and does not decide to poop, I and you as a parents cannot do anything about it.
Mm,
So we have to work around them. And
mm,
another important thing is they constantly fight for their independence as a children. So their way of expression of independence is to, the refuse the food what they want to do.
mm,
Sit all as a family together, make it a healthy experience, and especially for the autistic children, encourage them self-feeding. They have to develop their sensory
mm,
structure. So
mm,
the food has to be felt, smelt, and eaten. So the more you encourage the self feeding, the better the acceptance would be. And there should be a consistency, and the family should not break the consistency. That the parents do something, the grandparents, we all love our children. Grandparents come and break the structure, or someone else in the family breaks the structure. They get a mixed messages. So these are some of the very important tips,
yeah.
especially working for a picky children with autism.
Yeah, actually, one point that you mentioned on is consistency. And India, we do have more of a joint family structure, at least
Yeah.
till the grandparent level. So I
Yeah.
think setting that tone at every level is very important. The second thing that you touched upon was gluten free, and India is a heavy gluten country. We
Yeah.
survive on
Yeah.
wheat, most of the part of India. So, and firstly, is there any scientific evidence supporting that gluten-free diet works for autism?
Okay. Yes and no. See, if you think about gluten can cause three things. One is it can cause intolerance, where you can get the bloating or some tummy pains. There is something called celiac disease, which is a genetic based condition. Again, a children with autism does not necessarily mean that they have got an increased incidence of celiac disease. And the third thing is gluten allergy, which is very rare, where you take a gluten and you immediately develop anaphylactic symptoms. So celiac disease is very common. I think most of the hypothesis of autism comes and the symptomatology is drawn from there, because 1 in 100 children in the Western countries, and even of course, if it's seen in India, may have a celiac disease. The things with the celiac disease is they can have a tummy pains, they can have constipation. So parents tend to really relate that gluten may cause these symptoms in children. There is also another hypothesis in children with autism that gluten may cause a leaky gut, which can cause increased some of those chemicals in the blood, but it is not proven by scientific evidence. So the message to the parents is there is no relationship between a symptomatology of autism and gluten related symptoms. Of course, a child with autism may have a celiac disease, may have a gluten related symptoms. In that case, give a gluten free trial for a few weeks, see how the symptomatology work. If it doesn't work, please don't proceed, because
Yeah,
in that
yeah,
context what will happen is you
yeah.
will end up compromising the other nutrition,
Yes, yes,
especially the vitamin
yes,
D,
yes,
calcium,
yeah,
proteins, and the whole family has to go on a gluten free diet. It is not an
yeah.
individual child. Otherwise, there is no point. So, if it works for a few weeks and it is fit for your child, then do it. If it doesn't, please don't do it. Again, there is no evidence. There is no association between gluten and autism.
I think this will be this is something that parents are confused about. They go and they Google, and at times, a parent is actually trying to get some solution out. So, if you have a friend or a relative staying outside of India or anywhere, and you see that gluten-free worked for them, you end up trying everything. And this is exactly what I tell them, that if your child is happy with it, the gut is happy with it, there's no sensitivity, then why are you stopping another form of nutrition? So,
Absolutely.
100% agree on that. Yeah.
They
Plus, we as a
compromise on the other
society,
nutrition.
huh? Yeah, and so much of fiber, so much of iron, so many things will go with it. And yeah, I think I second that. I will actually end with one last question, which is around irritable bowel syndrome, around chronic constipation, which is something that we have seen. The two things that I commonly hear from parents is that my child has severe constipation or has a leaky gut.
Yeah.
So my question would be that how can parents manage severe constipation or leaky gut in their autistic child without relying on long-term medication?
Sure. Excellent question, and it's a very important question. See, first and foremost is all comes to diet. As I mentioned, the why the children with autism get constipated because of their selective eating and because of not able to achieve the food, not able to take enough fiber. So parents need to start working, if possible, about how they get that into the child. So one is making sure they drink good amount of water. They try to see if they can get some fiber into the diet, natural fiber in the form of fruits with skin. When I say fruits with skin, means well washed apple, pear, prune is a very good natural laxative. Brown bread instead of white bread, less chocolate, sweets, and pastries, more green vegetables. This should be a part of the very standard balanced diet, and it also works for constipation as well. When we talk about irritable bowel, so not one size fits all. There could be a number of factors which can make the tummy sensitive. It
Hmm.
could be a dairy product, it could be a gluten product, it could be a chocolate they eat. So one of the thing I tell parents is, number one, maintain a food diary. That is the very practical way of understanding your child and gut. So just make it a focused diet, and then start introducing a different kinds of the diet and see what is the symptomatology and try to correlate. If, let's say, if your child consumed a lot of dairy and that day he had a very upset tummy, and then probably that is a culprit. Avoid it or
Hmm.
maybe reduce it. So think about balanced diet, think about healthy diet, think about fluid and fiber rich diet, maintain a food diary. So maybe most of this problem surrounding these two important things can be resolved without
Ma-
medications.
You know, so when they maintain a food diary, I think something that you said earlier should also be a part of it. That what else did he do during the day? Maybe he went for a social gathering, which created a lot of anxiety. And then you're saying that because he had maybe some curd in the morning is why he's just rushing to the loo. But probably, like you said, that's not the reason. Other than food, there could be some other reasons also which are leading to him being
To
leaky
have a
in the
twitchy
room.
gut,
Yeah, to
absolutely.
have
I
a
mean, it
twitchy.
is
Yeah.
so
It
for
is
the
like,
irritable bowel, the whole concept is a twitchy gut. And again,
it
it is
is.
food is
Uh,
one factor, as you rightly said.
uh,
There is
uh,
other anxiety, stress, any of this that makes
uh,
them feel like to have a
uh,
butterfly in the stomach.
and the
Yeah,
reason
you are
I
right.
said it is because these kids do have a lot of, they go through stress a lot.
Absolutely.
So
And
probably,
let me
yeah,
tell you one thing, I see children with this gut issues. I must admire all the mothers of the autistic children. They do a brilliant job. It is
yeah,
not easy.
not easy.
Mothers are mothers, and I must say, you're also a woman. I must say that, really, the mothers are the really a cornerstone for, the managing these children, because they can be very, very challenging.
Very true. Very, very tough journey for any mother, but more and more for these mothers who have to manage a lot.
Absolutely.
Yeah, it's a very, very tough journey. I agree with that. This has been extremely enlightening for me also, Dr. Dinesh. I made my notes. I will go back with certain things that I have to further research on. Thank you so
Sure.
much for being a part of this.
Thank you for having me here.